Good afternoon. This topic is going to be about gangrene and its calcification. So, gangrene is necrosis of tissue associated with superadded putrefaction, most often following coagulative necrosis due to ischemia. On the other hand, gangrenous or necrotizing inflammation is characterized primarily by inflammation provoked by virulent bacteria resulting in massive necrosis. The end result of necrotizing inflammation and gangrene is same, but the consequence in which the two produced are different. Necrotizing inflammation. Example: gangrenous appendicitis, gangrenous stomatitis. In case of gangrene, it will be of dry, wet, and gas gangrene. So this is a general example of necrotizing inflammation and gangrenes. So necrotizing inflammation. So necrotizing inflammation is formed just due to ulcers and bacterial formation. Dry gangrene. This form of gangrene begins as the distal part of limb due to ischemia. Example: gangrene in toes and feet. Other causes may be Buerger disease, Raynaud disease, trauma, and ergot poisoning. General pathology of dry gangrene. It is usually initiated in one of the toes which is farthest away from blood supply, containing so little blood that even the invading bacteria find hard to grow in the necrosed tissue. The gangrene spreads slowly upwards to the point where the blood supply is adequate to keep the tissue viable. A line of separation is formed at this point between the gangrenous and viable part. So this picture shows the dry gangrene of the foot where the line of separation will be clear. So pathology. Grossly, the affected part is dry, shrunken and dark black, resembling the mummified foot. It is black due to liberation of hemoglobin from hemolyzed red blood cells, which is acted upon hydrogen disulfide, produced by bacteria, resulting in formation of black iron sulfide. The line of separation usually brings about complete separation with eventual falling of the gangrenous tissue if it is not removed surgically. Histologically, there is necrosis with smudging of the tissue. The line of separation consists of inflammatory granulation tissue. Going on to wet gangrene. Wet gangrene occurs in most moist tissues and organs such as bowel, lung, mouth, cervix, vulva, etc. Example: diabetic foot, which is due to high glucose content in the necrosed tissue that favors growth of bacteria. Bed sores, occurring in bedridden patients due to pressure on the sites like sacrum, buttocks and heel. So these are the examples of bed sores. Pathophysiology of wet gangrene. Wet gangrene often develops due to the blockage of venous drainage and also from the arterial blockage. The affected part is stuffed with blood, which favors rapid growth of putrefaction bacteria. The toxic products formed by bacteria are absorbed in the circulation, causing sepsis and death. They lack line of separation. So pathologically, the affected part is soft, swollen, putrid, rotten and dark. The classic example is gangrene of the bowel that may occur due to strangulated hernia, volvulus or intersusception. The part is stained dark black due to the same mechanism as in dry gangrene. Histologically, there is coagulative necrosis with stuffing of affected part with blood. The mucosa is ulcerated and sloughed. Lumen of the bowel contains mucus and blood. Affected tissue area entails acute inflammatory exudates and thrombosed vessel. The line of demarcation between gangrenous segment and viable bowel is generally not clear cut. So this is an example of wet gangrene in the bowel area. So general difference between dry and wet gangrene would be of the normal features are common etiology. The common causes of dry gangrene is arterial occlusion and for wet gangrene is going to be venous occlusion. Common site for dry gangrene is going to be limbs and wet gangrene is going to be bowel. Mechanism is same: ischemic hypoxic injury which leads to coagulative necrosis where there is little bit of blood supply which leads to fewer bacteria and causes gangrene. Where in wet gangrene, infarction leads to affected parts stuffed with blood which favors profuse overgrowth of bacteria. Gross appearance: organ would be dry, shrunken and blank. Less smell from putrefaction due to very little blood supply. Line of demarcation present at the junction between healthy and gangrenous part. Where in case of wet gangrene, part is moist, soft, swollen, rotten and dark. Marked order due to profound putrefaction. No clear line of demarcation. Microscopically, there is a presence of coagulative necrosis, inflammatory reaction and limited bacterial growth. Line of demarcation at the junction of viable with gangrenous parts present. In case of wet gangrene, liquefactive necrosis, inflammatory reaction and numerous bacteria, no clear line of demarcation at the junction. Systemic manifestations, it is less pronounced and wet gangrene contains fever and leukocytosis. Prognosis, in dry gangrene, generally better due to little septicemia, but in wet gangrene, generally poor due to profound toxemia. Gas gangrene, it is a special form of wet gangrene caused by gas-forming bacteria called Clostridium. Clostridia produce toxins which forms local edema and causes sepsis. So grossly, the affected area is swollen, edematous, painful and crepitant due to accumulation of gas bubbles of carbon dioxide within the tissues formed by fermentation of sugars by bacterial toxins. Subsequently, the affected tissue becomes dark black and is foul smelling. Microscopically, the muscle fibers undergo coagulative necrosis with liquefaction. Large number of gram-positive bacilli can be identified. At the periphery, a zone of leukocytic infiltration, edema and congestion are found. Capillary and venous thrombi are common. Thank you.